have recognized that if we're to go far, we need to be in partnership, because we know that this is not something that we're going to do alone. And that each one of us can make a difference. Each one of us can make a difference. We gathered together to discuss progress in child health, to look at best practices, and we were looking at surviving, thriving, and transformation. Survive speaks to things that are preventable, manageable, treatable. And many of you have chosen interventions to address those. And the presentations that you heard on the first day address that. And the question that I liked from one of the presentations was, do we trust our data? If the data in the DHIS does not match what was summarized, then planning becomes very difficult. And it becomes difficult to build a case, evidence for improvement or evidence for financing. The second day was about thriving. So the child has survived. Will the child thrive? And then today is about transformation. What are some of the big lessons that we have learned? Leadership, management, and governance are critical. Legislation for healthcare financing is critical so that the resources get to where they're needed. And although your hat, the hat that you wear, may be a technical hat, you need to jump into this arena that is not straightforward to participate in it. Because that's where the change will come. You all know what needs to be done as far as service delivery is concerned, health system strengthening. But it is the bigger leadership, management, and governance that is tough. And then Macharia told us, when we have partners who have helped us to put a program in place, let's find a way to infuse that into our budgeting and our planning as a county. So, for instance, in Macharia, they took the lessons learned from the work that they did with Chai on Maria, and as a result, the county has procured oxygen cylinders and pulsimeters after partnering with Chai. Another big lesson. There are many lessons that have come from the counties. Many lessons to do with things that you plan ahead for and things that you need to infuse. Opportunities in UHC. We've heard different models here. I think the takeaway is that counties really need to think through and be ready because it's coming your way. And those conversations need to start. And where they'll start is by understanding this UHC that the government has put into place. Because many people have not understood, and it would be great if there was a summary of it, a one-pager that said this, and that. Because that helps to get everyone generally to understand. But more than that, you need to have the policymakers, and many of you are policymakers. So, what is it that we're going to adjust? What is it that we're going to change? And that's the transformation. We've heard many things, working with public sector, multi-sectoral, all of that. All the things that we're doing are going to influence child health. And that is the beauty of what we have chosen to do. Because we don't necessarily have to have this vertical program. So the plans that you have put in place, we understand that there's a window of opportunity in the next 2 weeks to get these things included in the work plan. If your county health director is here, then that's fortunate. If not, you make it a priority. We are saying that it would be good to have completed the details on that plan by the end of the week. And for our partners, we are asking that you would facilitate so that we be able to see that. But there are things in there that you've put that don't necessarily require new resources because you're strengthening what exists. And those things, follow them through. It's very easy to make a plan and then get back to work and you go back to the things that have been waiting and the normal. So you will have to be deliberate about this because the time that we spent here has opened our eyes to what we knew about child health. We know that there's been progress. We know that newborn area is the vulnerable area, especially the perinatal deaths. We know that. We know we still need to do things around treatment of pneumonia, treatment of acute respiratory infections, treatment of diarrhea, malaria. We know. So that is not a technical challenge for us. It is those system things that we've talked about that must happen so that then our results improve. If the data in the DHIS does not match what was summarized, then planning becomes very difficult. And it becomes difficult to build a case, evidence for improvement or evidence for financing. So the follow-up that we do from here will be critical. We went out to the field, we saw a lot of things, and we have given feedback. Areas that were excellent, areas for improvement. Many of us could relate with those because we thought of our own facilities and thought, yeah, that happens here, that happens here. Perhaps we try this, or we do this. It seems that we do this better. So that was, again, to open your eyes. The symposium, there were so many tracks, so many excellent papers that were presented, a lot to learn. As Kenyans, there's a lot that we're doing, and the opportunity to present them doesn't come very often, and this was an excellent opportunity. I think we've all learned something, haven't we? Yes, we've all learned. And these lessons were coming from a diverse group of counties. It wasn't just one county presenting, it was a diverse group. And sometimes in life, it's important to pause, to reflect, and then to decide, what will I do differently? Survive, thrive, transform. Many of us are parents. And when you bring it home to yourself, and if you're not a parent, you're an aunt, an uncle, a sibling. If you can visualize now a baby that is 8 months old, seated, happy, laughing, doesn't that child deserve a chance to reach where you reached? Yeah. You are where you are because some system worked. Somebody led. Somebody was good in governance. And you may have had a very humble beginning, but somehow, because those systems were in place, you are who you are today. Many of you have classmates who, when you meet, number one, look 20 years older than you. Isn't it? Because they stayed back. They didn't get the opportunity. Something in the system didn't work for them. So you think of that 8-month-old baby, who may be your baby, or your niece or your nephew, and just think, what can I do so that they can have that chance that I've had? Because when we talk about the future, that is the future. That is the future. The people in this room, some of you are just on the edge of being the future, because you're still very young. But those children, and that's why we came up with the theme, every child counts. So let us put into practice the things that we have learned, the things we've committed to, and we've had county leaders here, like Dr. Elizabeth. It is a privilege to have had you here, because you know what it is that you need to do. I want to end with this. We had a conversation with a friend this week. And what we agreed is that if you want to influence, you must be present. If you want to influence, you must be present. So the things that you set out to do are not going to be easy. You may have a very difficult county health director, and you get back and think, what? I'm not going to be in that meeting. Don't do that. Sit there, difficult as it is, and influence. Never leave the table. Never give up the power you have. You have power because you've been here. And so you're going back with a plan. use that power. Don't lose the power. Don't lose the power. And then the second thing I'll say is that if you want to present a compelling argument, I'll give you 3 Greek words. Logos, pathos, ethos. 3. Logos, numbers. So you say, because our budget was X amount last year, we were unable to treat 100,000 children who died of or had to be treated but ended up dying because of pneumonia. It cost this much to treat them. If we had had X amount more in the budget, we would have been able to save X amount of lives. Numbers to support your argument. Pathos, appeal to the heart. Talk about what matters to your audience. The governors have children, so when you're interacting with them, appeal to that. That, isn't it wonderful? When we started on day 1, we had children here, isn't it? It made you think. And so you talk about how you want to transform this child's life, you want to give them an opportunity in life and what it is that they can do. Appeal to the heart, pathos. Then ethos is what is correct to do. The Constitution says that children have a right to health and education, doesn't it? So we are required to serve children, and the one way that we can do this is X, Y, and Z. A compelling argument. Logos, pathos, ethos. Those 3. Advocacy is not easy, and change doesn't come very easy in the political realm that we are dealing with and all the challenges. But at least if we develop the argument, we are present at the table, and then we do our bit. It will take time. You do your bit. You help to improve that community program. You be consistent in supervising. You ensure that the vaccines reach where they need to reach. You help the community health volunteer to know how to fill the forms. Health records information officers, you check the quality of data. County health directors, you boldly face the director for planning or finance, treasury, and the governor. You do your bit. And for us development partners, we need to stay relevant to fund what it is that is relevant to your county, not to come in with our own agenda. So if we all do our bit, all of us, we will see change. We will see change. Ladies and gentlemen, it has been an honor and a privilege to partner with you this week. God bless you as you go out and remain committed to make a difference for children's health in Kenya. And God bless your children. And I pray that they have a wonderful future because of what you've done, and that you are the role model that will ensure that we have transformed citizens, that Kenya will be different 10, 20 years from now. And we will be the ones in this room who can say that we were part of that. We had a legacy. We had a legacy. Thank you.